Hello and welcome to the 75th Bi-Monthly Breastfeeding Coalition's webinar. I'm Kinkini Banerjee, the Coalition Relations Director at USBC, and I'm so glad to welcome you to today's session. This series is jointly hosted by the CDC's Division of Nutrition, Physical Activity and Obesity, and by the USBC. And the webinars referred to as the 222 are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of this series is to bring together practitioners and advocates from across the first food field and across the field of maternal and child health to share best practices and resources, to talk about innovative partnerships, and to network and collaborate on issues of both state and national significance. And we alternate the sessions, so one time we have a state coalition or a state entity share, and then the next time we have a national organization present. So these webinars are free and access is open to anyone who's interested in this in the field of birth and breastfeeding. Coalitions and advocates from across the country can join us or across the globe can join us. And to get our announcement, please be sure to join the Coalition Learning Connection. And that is where we, is a great place to be updated with all of the happenings hosted by USBC and by our network. And to join the Coalition Learning Connection, it just takes a few seconds. You need a user account. And topic and speaker details are posted, as well as through the Learning Connection, but also on our public website. And these webinars have been set up as a series. So once you've registered, you've noticed that you don't have to register every other month for each one. You're automatically registered for the series, so you will get the announcements and reminders for this session. And after the session, you'll also get an evaluation. So please, please, please be sure to complete the evaluation, because we read your evaluations, we look at the topics that you're suggesting, the speakers that you're suggesting, and we bring those to you. So we really value your input and feedback on to make sure that the topics and sessions we bring you are meaningful to you. Like all of our sessions are recorded, and so we know that it's hard for folks in the middle of the day to make time to attend a session live. So these are recorded and put on the webinar page on our website, so you can access them at a time convenient to you. And we know that a lot of our network go back and listen and re-listen to the webinars as well. So the handouts, video recordings, and the slides for today's webinar are on the Coalition page. And one way you can do that is, if you don't, you should have the link in your registration email. But if you don't, and you want to access it through our public site, go to our website, www.usbreastfeeding.org. And then across the top, you'll see these tabs. Click on the webinar tab, and all of our 4 series will drop down through the drop-down menu. Click on the CDC-USBC bi-monthly webinar series, and you can have access to the slides today. And I believe Miriam has also chatted the link in your chat box, so you should be able to get there directly. We have a large number of attendees, so all participants are in listen-only mode, but we do want to make it as interactive as possible given the format. So please type in your questions and your comments during the presentation. And if you haven't done it before, here's how you do it. On the right side of your screen, you should see a control panel. If you don't see it, it might be minimized, and you'll see this very narrow bar. Click on the orange tab with the white arrow, and the control panel will show up. And then just under the audio section is a tab called Questions. Click on that question tab, and a box will open up for you to type your questions in. During the session, if you have audio or any other problems, send us a message through the chat box, the question box, or if you can't access even the question box, send an email to coalitions@usbreastfeeding.org, and our staff should be able to help you. And that brings me to today's session. Idaho Breastfeeding Coalition facilitates hospital and WIC community partnerships. At the USBC is honored to spotlight Idaho Breastfeeding Coalition today. As with any organization run entirely on the passion and commitment of volunteers, it's a challenge to build a sustainable infrastructure and capacity to be that backbone support and catalyst for collaborative action. And like many other coalitions, Idaho went through a stage of, reflecting, working, and discerning its own priorities across the, big geographical distances. And it is the dedication and commitment and leadership of the grassroots practitioners and the fierce advocates of breastfeeding that resurrected the state coalition to such an active one. We are so inspired. There's someone who needs to mute their line, please. If you're on the organizer panel, could you please mute your lines? Thanks. So we are so inspired by the action of coalition leaders and members from Idaho who kept at it, who explored the possibilities, kept reconnecting with each other, and developed and resurrected the coalition again. So very thrilled to have you. So during today's session, we'll hear how the state coalition supported breastfeeding, support transition from hospital to community. A small group project was the catalyst for expanded partnerships across rural and urban areas of the state, which included a health system consisting of 8 hospitals and community WIC peer counseling programs from across 3 health districts. And we learned some of the ways that coalitions play a pivotal role in implementing the Surgeon General's call to action. During today's session, our speakers will discuss specifically Action 8 of the Surgeon General's call to action, which is develop systems to guarantee continuity of skilled support for lactation between hospitals and healthcare settings. And I am delighted to introduce today's presenters. Cindy Galloway is a senior public health registered dietitian and the breastfeeding coordinator and peer counseling manager for the WIC program at the Central District Health Department located in the capital of Boise, Idaho. She's on the board of the Idaho Breastfeeding Coalitions and facilitates the Treasure Valley Breastfeeding Coalition, which is one of their local coalitions. Cindy has co-authored Education for WIC Peer Counselors about Breastfeeding the Late Preterm Infant, which was published in the Journal of Nutrition, Education, and Behavior. Cindy has been a speaker at the National WIC Conference. She co-chaired the first Idaho Breastfeeding Summit, and under her leadership, her WIC agency was the recipient of the Gold Premier USDA FNS Loving Support Award for Excellence in Exemplary Breastfeeding Support and Practices. Cindy's been a leader, and her passion is helping mothers to successfully breastfeed. A mom of 9 children and a grandmother to 28, Cindy is active, swims, kayaks, snow skis, and also plays the organ. So we are so thrilled to have you, Cindy. Welcome. Our next speaker is Cindy Bennett. Cindy has spent her nursing career. Cindy is a nurse at the St. Luke's Health System. She spent her nursing career focused on the mother-baby breastfeeding diet population with extensive knowledge of the unique challenges faced by the high-risk preterm and late preterm and full-term breastfeeding diet populations. Her specialty and emphasis is on the late preterm infant. Cindy developed the lactation department in the NICU at the largest children's hospital in Idaho State, and she's currently developing a lactation program in a sister hospital with a focus on well breastfeeding, which includes the continuum of prenatal, hospital, as well as postpartum follow-up care for 6 months. Cindy established and implemented the first human milk donation center in the state of Idaho and helped establish milk donation centers in Utah and Colorado as well. Cindy is a graduate from the Boise State University, and some of the innovative things that we'll hear about in today's presentation were first actually developed and piloted as part of a master's program. So Cindy is also a mother of 6 children and a grandmother of 12. Again, Cindy enjoys the outwork and ministry work in Peru. And with that, I'm going to turn it over to Cindy and Cindy. Thank you so much for being here.
Thank you so much. We are so excited to share this incredible journey of developing a community partnership between a hospital system and WIC breastfeeding peer counselors in the state of Idaho. And when we are talking coalition work, we are talking about folks who juggle much, including full-time employment, voluntary coalition work, sometimes in the middle of the night, and our families. So we thought we would show a picture of our families. Neither of us have any disclosures. The objective of this webinar is that the participant will identify how a coalition can facilitate a process of providing a transition of skilled support for lactation between a hospital and community WIC breastfeeding peer counselors per Action Step 8 of the Surgeon General's Call to Action to Support Breastfeeding. Idaho is fortunate to have reasonably high breastfeeding initiation rates. In fact, on the 2013 CDC breastfeeding report card, Idaho was first in the nation on 3 of the 5 breastfeeding measures. In the 2016 report card, Idaho was second in the nation for initiation rates. While breastfeeding rates have continued to rise throughout the nation, many mothers are not meeting the recommendations for continued and exclusive breastfeeding, nor are they meeting their own breastfeeding goals. Helping mothers achieve their breastfeeding goals can be improved through active support from their families, friends, communities, clinicians, healthcare leaders, employers, and policymakers. And most importantly, 2 are the WIC breastfeeding peer counselors. This is a visual of our state. And yes, as Kankini was describing, we have a large state that's very spread out. The yellow area is Health District 4, or Central District Health Department, and this project started with the WIC program in that area. This webinar will illustrate how this can be a model for expansion anywhere. It started as one WIC agency in one community and one hospital working together. And what is WIC? Women's, Infants, Children's Supplemental Nutrition Program under the direction of the USDA FNS services. And qualifications for participation, to simplify, are by low income and nutritional risk. WIC programs are able to provide breastfeeding support to their WIC participants. Where did we start? In 2009, as I was looking things up, nearly 10 years ago, I, Cindy Galloway, started a local coalition. I had a vision that WIC peer counselors could visit WIC participants in the hospital. That was a very naive vision. So I approached my colleague here who's sitting by me, Cindy Bennett, who works at a local hospital, and I said, what about it? Can the peer counselors come to your hospital?
Yeah, she did approach me with this question, and I was talking with Cindy and Dr. Jane Grassley, and my exact words back was fat chance that will ever happen. I seriously could not even fathom or think about this kind of a project in a hospital setting. At that time, I worked both in the NICU and the mother-baby unit, and I could not even figure out how to go through all the layers. Additionally, though, I'd like to share that I was encouraged to go back to school and get my master's degree in 2013, and this project, the story of this project was part of that.
So as I mentioned, a local coalition just in one little small area. We were very informally organized. We had a small bank account. We met quarterly during lunch times, either a choice of coming in person or via phone call. We later, several years later, got a Facebook page, so that was our big accomplishment. We would collaborate for World Breastfeeding Week and do some other projects. I would like to point out two pretty substantial projects. Idaho at that time and until very recently did not have any laws that were protective of breastfeeding moms in public. Our local coalition wondered what we could do to sort of move that along. So we did a Nursing as Normal in Boise YouTube video where we took pictures of moms who are breastfeeding in public, and then we distributed this video, and it was shown multiple places, but it gave a lot of women the idea that women are breastfeeding in public, so we just do it. We just do it.
Just do it.
Another notable project, we did a breastfeeding-friendly city assessment in this area. This coalition, this local coalition, because of the work of our partnership with the hospital, and the hospital was bigger than life. So we ultimately spread this project or expanded our coalition, and it's not just the local Idaho Central District Breastfeeding Coalition. We expanded it just recently to be the Idaho Treasure Valley Breastfeeding Coalition because there were hospitals that were working together and WIC programs that were working together that throughout this whole valley, and so that made sense to us. But then you wonder, okay, that's a local coalition. There really hadn't been a very active Idaho breastfeeding coalition. There had been an informal Facebook organization by a couple of busy gals in North Idaho, and I'd like to pay tribute to them, Patty Omott and Marie Walden, who, like most of us, were stretched thin and did not have enough time. Well, I kept wondering why no Idaho Breastfeeding Coalition had really been organized and who might step forward. When you wonder, sometimes it becomes your job.
Yes, it does, doesn't it, Cindy? I'd like to share that the cool thing about being involved with the coalition is that you really have a mix of lenses from different disciplines. And so there's a great opportunity for awesome teamwork. And we know that when you tap into the many different disciplines that are available, you can get a lot done when you work in a coalition.
So that wondering became the birth of the Idaho Breastfeeding Coalition. The Idaho Breastfeeding Coalition started informally with similarly to that local coalition where we did bi-monthly phone calls or in-person meetings including statewide stakeholders. The calls alternated on lunch hours on 2 weekdays and included participants from 2 time zones. And we did that for over, I think it was 18 months before we got even more formal with our organization. So the formal organization occurred December of 2016, and just prior to that we adopted a website that was existing that I had the opportunity to kind of spearhead and thought, this is really great, we'll just move this website or have the coalition adopt this website. We developed articles of incorporation. We registered with the state of Idaho. Within a year, we were a 501c3 nonprofit tax exempt organization. And as Kinkini mentioned, we've already had 2 Idaho breastfeeding summits, 2017, 2018, and we are planning our 3rd annual breastfeeding summit. The mission statement for this coalition is to facilitate a community and statewide landscape that protects, supports, and promotes breastfeeding as the biological norm for a healthier Idaho. Vision: there are no obstacles to breastfeeding in Idaho, and we're intending to make that happen. More than just a vision.
Absolutely, absolutely.
So there were 3 action steps that we seriously looked at from the Surgeon General's report. First of all, Action 7, and won't take time to read that, but Action 8 became the one that sort of this project fed into. This is developing systems to guarantee continuity of skilled support for lactation between hospitals and healthcare settings in the community. And two sub-actions that we developed too: foster communication, build strong networking system among stakeholders, coalition support in acute care to community transitional support for late preterm and at-risk infants. In fact, the project that Cindy Bennett will go into more depth about was sort of fledglingly started, and then the coalition said, because that's already ongoing, we want to adopt Action 8 and make that a serious part of our coalition. The third action step we adopted was Action 11. So this is a slide that I was working on, and while preparing this slide, Cindy Bennett again she was on a trip, and I saw a picture on Facebook that I thought really well was a great visual for this bridging the gap from what goes on between hospital and home. So first of all, we have a hospital, and then we have a home, and should I pull up the picture?
Yeah, go ahead. Okay, thanks, Cindy. So before I talk about this picture, I need to share some information prior to bridging the gap from hospital to home. Discussions about having WIC breastfeeding peer counselors began in 2010, as we just shared. In 2012, before this project, Cindy, myself, and Dr. Grassley and the BSU nursing leadership class developed an educational PowerPoint module that was designed to enhance the peer counselor's knowledge on care of the late preterm infant breastfeeding diet. At that time, there was not a specific training for the WIC breastfeeding peer counselors on the special care needs of this diet, nor was our hospital doing any type of follow-up program. Just a really quick overview of the late preterm infants. These are babies that are born between 34 and 36 completed weeks gestation. They do present a particular challenge to their moms who want to successfully breastfeed and to the medical team as well. Nationwide, late preterm infants comprise 70% of all preterm births in the United States. Compared to the full-term infant, the late preterm infant experiences suboptimal breastfeeding due to their physiological immaturity. They do have the highest readmission rates back into the hospital, and almost $93 million has been contributed to overall rehospitalization costs nationwide. And I have personally seen this myself as a nurse. I would be called to the ER and to the pediatric ward. These babies usually come in because they're jaundiced or a failure to thrive. So the picture that Cindy pirated was done in 2018. I was in Peru at Machu Picchu, and this is the Inca Bridge Trail. There is a 2,000-foot drop-off. That trail is teeny-weeny. It was one of the scariest things I've ever done in my entire life. I actually went back 3 different times before I completed it, and that's kind of how this project was a little bit. It was scary, but you know what? When you surround yourself with like-minded people to achieve a goal, then it makes that trail easier. So now let's jump up to 2014. I updated the late preterm infant PowerPoint educational module that was made available to all with breastfeeding staff. So now it wasn't just the peer counselors, but it was the staff as well. The purpose of this new PowerPoint educational module was to enhance the peer counselor's ability to offer appropriate support for the late preterm breastfeeding dyad. Topics discussed included characteristics of the late preterm infant and the benefits of human milk, typical infant behaviors that affect breastfeeding, lactation technologies that help moms establish a milk supply, mothers' experiences, and warning signs that there needs to be follow-up. Additionally, I designed a self-efficacy scale and it was titled Breastfeeding for the Late Preterm Infant, educational session for the WIC breastfeeding peer staff. We really wanted to know if this educational module made a difference, and it did. There was 8 pre-post questions, or 8 pre and 8 post questions on this module. And there was significant difference. Sorry, we can't show that to you because there's not enough time. You can tell. Sorry.
So I did a same title for this particular slide because I wanted to
introduce our beautiful gals, right?
Real faces of actual peer counselors bridging this gap. Deborah, Rosalena, Sachi, Brenda, some of the peer counselors who've worked on this project.
So between 2013 and 2014, a new concept emerged, and that was to normalize the WIC breastfeeding peer counselors into a hospital setting. This journey began to take place once I met with the Women's Service Line Administrator, Dixie Weber. So to encourage you all, if you want to do a project like this, it is really important that you do have a major stakeholder and somebody that can help navigate you through a hospital or the system. It's very helpful. We also determined at this time that the WIC breastfeeding peer counselors did not need to complete the volunteer training program because they were already visiting mothers who were their clients. The other thing too, this is like moms seeing their seeing their doula, their midwife, or a life coach. And also the peer counselors are not charting in the hospital system. I do want to share with you that the majority of evidence from randomized controlled trials evaluating breastfeeding peer counselors indicates that peer counselors effectively improve breastfeeding rates of initiation, duration, and exclusivity. So I was often asked why breastfeeding peer counselors, and my answer back is why not? They are prepared and they're qualified for this. Again, we all used the Surgeon General's call to action to support breastfeeding. Action 4 was the one that I used, which states, advocates the needs for partnerships between hospital and community-based organizations. I do want to share, too, that the breastfeeding peer counselors offer unique combinations of skills from formal education, prior breastfeeding, shared experiences, anticipatory guidance, and emotional support, and often have similar ethnic backgrounds and socioeconomic status. Peer counselors refer their mothers to appropriate lactation experts or healthcare professionals if the mother's concerns are outside of the peer counselor's scope of practice. And yes, the peer counselors do have a scope of practice. Cindy will share about that later. The peer counselors offer this support at the hospital, at home visits, clinic visits, phone calls, and texting. And we know that texting is really big right now because that's how a lot of communication happens. And then
one of the great benefits to this project is that all states and many WIC agencies nationwide have existing peer counseling programs. Hospitals partnering with WIC and that existing program provides breastfeeding services to a very vulnerable population, those who are low income and are at nutritional risk.
Yes, so if you're in a hospital setting and you bring up the fact that you can offer free resource, you'll grab a lot of the attention. We know that healthcare is very expensive and the breastfeeding dyad population is not always seen as a priority, and they should be. We also know from multiple professional organizations that breastfeeding is a preventative medicine, and helping a mom successfully feed her child saves healthcare dollars.
Again, we are just real people doing our jobs. Myself with our lead peer counselor, Lori, and 3 of the current peer counselors. WIC is uniquely positioned to be a hospital partner.
Yes. This project was broken up into 3 phases. Phase 1 was to engage the stakeholder. Phase 2, create a process. Phase 3, diffuse this process. The conceptual framework, innovation in healthcare delivery systems, guided the development and implementation of an innovative process to establish a sustainable community partnership between St. Luke's Children's Hospital and the local WIC breastfeeding peer counselors to improve breastfeeding outcomes for the late preterm infants and their mothers. The WIC breastfeeding peer counselors complements the care that the breastfeeding dyads receive in the hospital, and I want to just stress that. We see it all the time. All barriers were addressed. Over a 6-month period, 39 different interactions took place with stakeholders, which included individual conversations with administrators, group meetings with hospital subcommittees, and the State Board of Health, and conference phone calls. These included single interactions with peripheral stakeholders and multiple interactions with key stakeholders. So now we're going to move on to 2015 to 2016. Major work took place here. Referral pathways were created for both the hospital side and the WIC side, and you can see them on this slide. It took a lot of time, a lot of discussion, a few tears probably on my side. Authorization forms were made as well in English and Spanish. So when you're working with these two big organizations, the computer systems don't read one another, so we fax over our authorization forms. The final step in preparing for the pilot was to invite the WIC breastfeeding peer counselors to the hospital for a tour. Main focus here was to really help the peer counselors to feel supported and confident coming into a hospital setting, because a hospital setting can be a little bit intimidating. The pilot went live on January 15th and was piloted for 4 weeks. We found that this type of partnership between the hospital and the local WIC program did in fact successfully establish a sustainable communication process for providing early breastfeeding support to mothers and their late preterm infants. It's very important to understand that the WIC breastfeeding peer counselor's purpose is to expedite early support by establishing contact with the mother before hospital discharge. This helps facilitate continuity of breastfeeding support between the hospital and the community. This slide here is the results of the project over the past 4 years. So late preterm education was developed for the WIC peer counselors, normalizing WIC breastfeeding peer counselors to the hospital setting. The hospital notifies WIC that a participant has delivered, and WIC peer counselors regularly doing rounds at hospitals, and we'll get to that here in a minute.
WIC participates in the Loving Support Peer Counseling Program, and because of that, has the opportunity to apply for an award. I looked at the application in 2015, and I'm back, Cindy Galloway, and realized that existing community partnerships was key to being eligible for the Gold Premier level of this award. I worked a year on refining and solidifying our breastfeeding and peer counseling policies and procedures, and continue to support our hospital partnerships. So this slide illustrates that this project began as the first Idaho map, or a visual that I did earlier in the presentation, in the yellow area on the map in Central District Health Department, Health District 4, to include not one hospital, but now includes 4 hospitals, and expanded to South Central District, which is the red area of our state, where there are 3 hospitals, and finally expanded to Southwest District Health District 3, which is the darker blue color, where there is 1 hospital. The coalition lens brings together that there are multiple perspectives being addressed in the development of this project, including, as Cindy Bennett mentioned prior, the coalition lens is not the same as the hospital or the WIC lens. IBCLCs who are nurses have a different lens than the IBCLCs who are possibly WIC staff or WIC staff dietitians, and those different views were woven together in the carrying out of a common purpose to help breastfeeding dyads. The lens of hospital staff roles was explored as the hospital staff were educated on the policy of normalizing, I love that word, normalizing WIC staff to visit shared patients in the hospital. Both hospital and WIC staff receive ongoing training on cultural awareness. Moving to the scope of practice, this is truly about relationships. You may have questions about the relevance of having had WIC peer counselors involved in a project with late preterm babies. One of the biggest benefits of peer counselors being the first to know when there is a problem. Peer counselors who have a relationship with a WIC breastfeeding dyad know and understand that their own role as in asking questions and assessing if a baby is preterm or early term, and then in additionally listening for signs of breastfeeding problems. The peer counselor provides referrals. One of the peer counselors was doing that, just listening to a mother over the phone when the mother said, "New baby was so good and had slept 6 hours," which raised some red flags, and the peer counselor asked some more probing questions, and then concluded and advised that the mother talk to the healthcare provider. And there definitely were some serious issues, and that baby was hospitalized and as well now. But that was the key. It was that listening of that peer counselor. So key to what peer counselors do is that listening, and then they provide appropriate referrals. Peer counselors are in a unique position. They identify with these moms. They've been there.
Yep.
During our recent exit surveys, 90% of our moms said texting is their preferred method of being contacted. Moving on, WIC participants, the Hispanic ethnicity by counties in these areas that we are talking about in the state of Idaho. This slide illustrates that there are multiple counties where the WIC Hispanic participant populations are greater than 30%, even as great as 81%. If you'll look at the bold black numbers there, there are counties that fall into those percentiles. Another group is the Idaho refugee arrivals by region of origin. They come to 2 areas in Idaho, and both of those areas are in the same, they come for resettlement in the Twin Falls area, which is in that red area, and the Boise area, which is in the yellow area. There are refugees in both of these areas from Africa, East Asia, Europe, and Central Asia, Near East, and South Asia. The Boise area has several sponsoring agencies, and each agency provides varying levels of support services to the refugees. Second one, and now the third one. The third agency was closed in 2018. In the Twin Falls area, the College of Southern Idaho oversees the refugee programs and provides services to those refugees.
Okay, so now we're coming to the outcomes. This project is still evolving. One major outcome is now all WIC breastfeeding dyads are included in this service, not just the late preterm infant dyads. The primary outcome of the initial study component of this project was to evaluate the feasibility of the process. It was successfully implemented with no added cost that made this project sustainable. Prior to May of 2018, only the lactation consultants in our hospital system had the capability in our computer system to ask if a mom was on WIC. Well, that's not very helpful. One of our nurses in one of our smaller hospitals wanted to have the special resources of the WIC peer counselors, and so a change was made. So now when a mom comes into the hospital and is admitted, the nurse asks her if she is on WIC. If she is, does she want to sign an authorization form? If she's not on WIC, would she like to get more information? Great, great resource here. All St. Luke's Health System hospitals and all 3 WIC departments received the same support and education that was originally developed and tweaked to meet their institutional needs. Some of St. Luke's hospitals send in the WIC authorization forms, which still puts the WIC breastfeeding peer counselor in contact before hospital discharge. So this is the beauty of this project. It can be adapted to any needs in your institution. Currently, there are 2 hospitals that have implemented normalizing WIC breastfeeding peer counselors into the hospital setting, and we are in the process of working with a 3rd hospital as well. Our newest hospital, Nampa, it opened up in October of 2017. Under the leadership of Shanette Fretwell, manager of the Nampa Women's Services, and her team of nurses, they've implemented this program as well with WIC District Number 3. Elizabeth is our peer counselor there. She makes rounds Monday through Friday as we need her to. And the added outcome, too, here is that she will also see a family who might qualify for WIC. She gives them a WIC trigger card, and she answers questions. Remember, this is very vulnerable families that really do need this resource. Since May of 2018, Elizabeth has made 228 visits to her WIC participants, and she has also seen 80 potential WIC participants. And now Cindy's going to share about her agency.
Since the project began, our WIC agency alone in the yellow area in Central District Health Department has been notified or received authorizations by the 5 area St. Luke's hospitals that are close by for over 400 WIC participants, which have delivered, which has allowed WIC staff, including the breastfeeding peer counselors, to reach out to these WIC participants to provide breastfeeding support even while they are still in the hospital. We also have a peer counselor who has started doing rounds at the St. Luke's Meridian Hospital twice a week. Here is a quote from that peer counselor, Brenda. I've been doing hospital rounds for about 4 months now, and it's just been amazing. I visit with new moms that just gave birth and give them the support needed about breastfeeding and guide them on what they need to know when they come home. I also offer to help if they are having issues with latching. It's been wonderful. It's been a wonderful experience for myself when I'm able to help new moms with breastfeeding and happy to see them latching and nourishing their babies and giving them the best.
So this project really brought together a mutual goal of supporting breastfeeding dyads, and along the way, many relationships were established. For example, respect for one another's strengths and trusting that each organization's focus is to support the breastfeeding dyad. Finally, this organizational pathway may seem simple, but it required time, ongoing discussions with all stakeholders, and careful planning. Factors that facilitated the successful diffusion of the pathway throughout the health system included clarification of the project's purpose and the peer counselor's role, influential organizational champions, and the hospital and WIC, intentional introduction of the peer counselors to the hospital, addressing hospital staff concerns, and flexibility on the part of the project director.
So acknowledgements are this Idaho Central District Breastfeeding Coalition, which is now the Idaho Treasure Valley Breastfeeding Coalition, which was the way that the two of us met.
Yep.
And then the Idaho Breastfeeding Coalition, which adopted, an action step that was meaningful to this project. And definitely the St. Luke's Hospital System and the Central District Health Department WIC program.
You've heard us talk about Dr. Jane Grassley. Here she is. Dr. Jane Grassley is a professor of nursing from Boise State University. She's also a member of the Idaho Breastfeeding Coalition, and she was a key player in helping to facilitate this ongoing community partnership. To highlight breastfeeding excellence in the state of Idaho, the Idaho Breastfeeding Coalition created an annual award to recognize an individual who fulfills the mission and vision of the Breastfeeding Coalition values. This annual award will be presented to individuals who demonstrate leadership, dedication, and compassion for breastfeeding families within the great state of Idaho. The creation of this award was inspired by Dr. Jane Grassley's lifelong contributions and commitment to breaking down barriers to breastfeeding. Through her research, leadership, and mentoring, she has touched the lives of many and shaped the career path of numerous professionals, which has been a positive impact on breastfeeding families in this awesome state of Idaho.
These community partnerships have expanded now to include a new project with Boise State University with the development of a website and testing of that website. This website provides anticipatory guidance during pregnancy for preterm and early-term babies. The web address for this website is with your webinar resources. This website was developed by Dr. Jane Grassley at BSU and myself, Cindy Galloway, from the WIC program, and Patrick Lowenthal, a BSU IT professor. This was piloted with some WIC participants. Coincidentally, WIC provides evidence-based best practice nutrition and breastfeeding support. After we had had this idea for the website and had developed it, the WIC nutrition risk number 142 was changed from preterm to include preterm or early term deliveries. As we know, there may be feeding issues, including breastfeeding issues with preterm and also early term babies. This slide illustrates that WIC recognizes this, which reinforces the relevance of developing the website on the prior slide. Our community partnerships have provided peer counselors with the tools to assess for these breastfeeding dyads and appropriately refer.
So in conclusion, this is a picture of Deborah, one of Cindy's peer counselors. This is one of Deborah's twins. I'd like to share with you that Deborah had late preterm infant little boys, and she was in the NICU where I worked. What an awesome peer counselor, seriously, for the late preterm babes, and she's just a great gal. To the right is 2 manuscripts that we have that you will have a link to. The first one is a community partnership to support breastfeeding mothers of late preterm infants. Dr. Jane Grassley and I wrote this manuscript. This gives you detailed directions how to do this type of a project. The referral maps, everything is in there. We spent a lot of time on this one. The second one is the education for WIC peer counselors about breastfeeding the late preterm infant. Myself, Cindy Galloway, and Dr. Jane Grassley authored this one. This gives you great detail into how we prepared and designed the education for the WIC peer counselors.
Thank you so much for providing us this opportunity to share about our great state. And we'd like to open it up now for questions. Yes.
Great. Thank you so much, Cindy. And Cindy, for this terrific presentation. Just makes the case of how vital partnerships are across the continuum of care. So thank you. We are going to take questions, and we have quite a few that have come in. One is, Linda asked, what was the main concern when you had to, what were the biggest barriers that you had to, overcome in convincing hospital administrators to have peer counselors in the hospital? And, some strategies used. I guess there are others who are trying to go that route.
Right. There was a lot of barriers. That's why I said fat chance this will ever happen. But the number one thing is finding that one key stakeholder in your hospital. Grab your research. That's what I did. I had research. I worked really, really hard. We worked really hard to prove that this was an important thing. We needed to do it. And once you get that research, because, right, hospitals are supposed to be operating on evidence-based research, you put this stuff together and you present it and you find that one stakeholder, and then from there it's kind of a ripple effect, and it will take time. Oh yes, we had one, my doctor, my medical director. So you sometimes have to use names, and I don't always do that, but he was like, Cindy, you can't do that here. And I'm like, well, yeah, I can. Dixie said I could. Oh, okay, well, if she said that, that's okay. So once you find that, oh yes, sorry, Cindy, he looked at me and he said, well, how old are those peer counselors? And I said, well, they're not my age. And then he went, oh, duh, yeah, and we laughed about it. So you're going to have people that are going to want to talk about stuff that might not even be relevant to this project, or that is relevant, but you got to build up those relationships and build up that trust. So I hope that answered that question correctly, because there are going to be barriers. There are. We still have a few barriers, and it's always evolving.
Thank you. Very helpful. Those early champions building trust relationships. Another question is, how do peer counselors coordinate care, with the ambulatory pediatric care physicians, particularly among your at-risk infants? So, in the ambulatory setting.
So in general, peer counselors use a referral process of, if they are a couple of things. One, if they see a need that this breastfeeding mom needs to contact her health provider herself, that's what she will advocate for. She won't go directly to the healthcare provider. She will work through the participant, the breastfeeding mom, and encourage the mom to do that. And then part of that referral process is letting myself, I'm the breastfeeding coordinator, I'm the peer counseling manager, so they let me know. So if it's something that I can personally help that mom with as a WIC participant, then that's what I'm going to do. Otherwise, additional referrals might be made. Or because we have this collaboration, I then am free to call the hospital if the mom's okay with that and talk to the lactation folks at the hospital.
Yeah, I mean, it really has just opened up the doors for care for our breastfeeding families.
Wonderful, thank you. And Rebecca asked, do the peer counselors work with clients prenatally as well, right? And do they do they work with clients prenatally?
Yes, indeed they do. So these peer counselors are, well, the WIC participants are assigned at their first WIC visit to have a peer counselor, and then the WIC peer counselor contacts that particular participant, asking and inquiring how that participant would like to work things. In general, we have a protocol where they're contacting them monthly during pregnancy, and then as they get closer to delivery, those contacts are more frequent. And then they're, providing answers to questions. And as we mentioned before, a lot of that is done by texting. So in that first contact with the mom, they're trying to figure out what is going to work best. Would that mom like to be texted? Would she like phone calls? And then we realized, too, that texting has its limitations. So if a mom is actually having problems, that's when a peer counselor knows better and says, let me call you because we need to, be able to have a faster two-way conversation about this. So, yes, prenatally indeed, and postnatally too.
Thank you. Another question is about the peer counselors who mainly interact with moms via phone and text, and then sometimes would, transitioning to visiting them in the hospital. Is that sometimes the first time they see them in person, or have they had like face-to-face contact before? And how are there any specific, support strategies that you all use for, that first transition from text support to in-person support?
So in general, there isn't a face-to-face meeting until that hospital visit, but there are other options. If the participant really, really wants to meet her peer counselor, our peer counselors mostly work from home, and so we can arrange for a peer counselor to come in when a peer participant wants to meet her, or they could maybe meet at the breastfeeding class that we offer. And occasionally that is something that a participant wants. Otherwise, that first face-to-face might be in the hospital.
Yeah, and so that's Cindy's side. So over in Nampa, where I'm at, a lot of times when I will have the mom sign the authorization form, they've already met Elizabeth or they know about her. So here again, each area can have a different way of how they're interacting with their peer counselors.
And we know in other parts of our state there are other ways that have been set up for peer counselors being in the hospital that didn't happen under the shell of this particular project. But it was, I'm hoping that our influence was why they really moved towards it, instead it's being done other places in our state. We know it's done throughout the country, so we give kudos to the rest of you who have already done this and made inroads in this sort of in these sorts of projects.
Thank you, Cindy. I mean, there are so many questions and specifically there are some related to WIC, but also, questions with your other communities. The northern part of Idaho, is that in terms of a lot of the activity happens in the 3, 4, 5 regions of those. How do you see your overall rates in Idaho, seem high. We see that when we see that, but then again, the exclusive, are there big gaps in your assessment between geographical differences within the state in breastfeeding rates at 3 months and 6 months, duration rates, and initiation too?
Yeah, several things. In North Idaho, that area 1 that showed on our map has even higher initiation rates than the Boise or Treasure Valley area. They happen to be the area where the first baby-friendly hospital was established in Idaho more than 10 years ago. Mm-hmm. So I think that was influential, but they're a little bit different demographic too, but they have high initiation rates, higher probably than the Boise area. Maybe we're all about the same, but they have higher continuing rates too. And so does Health District, trying to get the right number, 7 in Idaho, higher than the Treasure Valley area. I can't really speak to why or how.
I know. That's interesting.
Yeah, but I think we just, as a whole, are very supportive. And I want to back up just a second. So when we first had those local coalition conversations about things, there were some of my staff, my WIC staff, who would say, well, I hear this about the hospital, that they're not that supportive. And I said, I trust the hospital folks that I know. And I knew that even though there sometimes are occasional sabotaging of breastfeeding that may go on in a hospital, that was not happening in our area. They were very supportive of breastfeeding, so the providers were, the hospitals were, and they strengthened their policies over these last 10 years, 5 years, to be even more supportive of breastfeeding. So my way of handling that when I would hear it from staff is saying, I trust our hospital folks. And I think that made a difference in being able to establish a project like this.
Yeah, it really did. Remember, we go back to relationships, and it truly is relationships within organizations. Yeah.
Mm-hmm. Thank you. Yeah, we have so many questions, and we're running out of time. About, do you have like a texting policy around concerns for HIPAA? Folks asking if you can share. So we did post that a link to the website that you had mentioned, but other resources, the breastfeeding, and then Melanie asked that could such collaborations also work with other organizations that do nonprofit, that do peer support, such as La Leche League or Rose or other Reaching Our Sisters Everywhere. And I would, do you want to take that, Cindy?
Well, I'll take it, and then there's Cindy. So because when you think about it, healthcare is moving to a population healthcare model, and that oftentimes means things that are different, things we've not seen before. And if you've got an organization and that mom's already working with a La Leche League sponsor, then why not? It can be done. You just got to do that groundwork and get the foundation set. Because once you have a solid foundation, and that's key, a solid foundation and a process, absolutely. I think we're going to see big changes.
We will. And yeah, go ahead, Cindy.
Just quickly on the texting policy, we do, but it probably doesn't, pass muster with HIPAA, because WIC doesn't necessarily have to be HIPAA compliant, at least from our understanding where we are. But they do use a phone that is owned by the health department, so they have their password protected. So there's some protections in place that way. I'm probably not the best person as far as texting policy. There's probably some maybe national WIC people that could do better than me.
Yeah, and they don't do anything in the hospital system, so it doesn't affect any of that.
Okay. Well, thank you to you both for a terrific session. And while we are having, the next segment of our session. Miriam is going to post some links. We've had a wonderful session from Reaching Our Sisters Everywhere about their Community Transformer grant. We've had presentations from Health Connect One. So there are numerous other community-based organizations that do fabulous support of peers and that continuity of care in the community. So Miriam, if you can post some of those links to those webinars, as well as the one that Hakima Payne did about cultural safety. So as that's happening, thank you again, Cindy, to both of our Cindy's and to the Idaho Breastfeeding Coalition and your partnerships for a terrific session. I'm going to invite Carol McGowan to give some CDC updates at this time.
Hi, everybody. It's good to be with you again. And thank you, Cindy and Cindy. That was an outstanding presentation. I'm not going to take much of your time because we're past time. So I'm just going to make two very quick announcements. One is that we have and this was in the weekly wire, but if you don't get it, we have a guideline for storage of breast milk, expression storage of breast milk, where you can download a fact sheet. And we also developed, under the leadership of USDA, we collaborated with USDA on magnet that can be downloaded and printed for mothers to post on their refrigerators. I think I copied the link, but well, the link is on. I'll have to send the link out. But if you go to cdc.gov/breastfeeding, you can write to our site and you can find those two pieces of material that I think will be useful to your clients. The second thing I wanted to mention was that the Maternity Practices in Infant Nutrition and Care, or the MPINC survey, every hospital that was eligible to fill out the survey has been contacted in the country. There are a few hospitals where we reached the maximum number of calls, which is about 11, and we were not able to connect with them or make a connection with them. But for the most part, the hospitals are in the process of completing their survey. So if you talk to hospitals in your state or in your community, you should be able to, in most cases, find out that they are in the process of completing those surveys. If you have any questions about that, feel free to contact me at CDC. And I think that's all I have for today.
Great, thank you, Carol. And we'll make sure to send the links to our network as well. So we will do that. And now I'm going to invite Camille Abbey, our PR and Events Manager, to give us a quick update on the National Breastfeeding Conference and Coalition that's coming up in June. Camille?
Thank you, Kinkini. Thanks, everyone. I did chat the CDC link on the recommendations for handling breast milk into the chat.
Thank you.
One that I know we were looking for. I grabbed that from the wire. So yes, I can't believe it. I'm sure you all can't either, but it is going to be 2 quick months before June. It's like less than 8 weeks before our National Breastfeeding Conference and convening in Bethesda. So it's coming up quickly, and hopefully you have thought about registering or are preparing to register, or maybe you've already registered if you are going to be able to attend and participate with us. We have a lot going on with the event. We've been updating our preliminary program very often, so you can see a lot of the details about the great sessions we'll have. Also, we have marketing opportunities. So of course, that's, if you're with an organization that has a business, a service, or you'd like to share something, we have some free space on our coalition's sharing tables. So I want to make sure everyone knows about that. You can put one item on those, but if you'd like to have your own table for your own event exhibit space, please make sure you check in with our website or with me personally if you need any help with that. So we have lots of marketing opportunities in addition to exhibiting, and also just wanted to remind folks to connect with each other. Right now, now, we're building the app, so there's going to be a conference app. But for the meantime as well, we have a Facebook event. So if you have a room and you'd like to get a roommate, that's a great place to find that person. Or if you just like to talk about, what's going on and plan ahead, please connect with us. So either on the Facebook group or always, you know how to reach us, and via the website as well. And we hope to see you in Maryland in June. Thank you.
Great. Thank you, Camille. As you can tell, the staff team is super excited, and we can't counting down the days and to seeing you all. So, and again, be sure to stay in touch with the USBC. And that brings us to the end of today's session. Thank you for a fabulous session, Cindy, and to all of you, our participants, for the vital roles that you are playing in improving maternal, infant, and child health throughout our country. So stay tuned. We hope very much that today's session will spur ideas for you for collaborative action. We'd love to highlight your work as well. So please complete the webinar evaluation and let us know how we are doing. Your suggestions are valued. So with that, goodbye for now. And until next time, we'll see you with a new session and a new webinar in June. Thanks, everyone.